Here are 8 sneaky signs you are in silent liver failure and don't even know it. Today we will discuss a very serious problem: liver failure. Liver failure, a serious disease, is an often silent disease in which the symptoms are not visible until the disease has progressed considerably. One of the largest and most important organs in the body, the liver, plays the role of detoxification, metabolism, and producing important proteins. But when the liver suffers from any conditions that lead to decreased functional activities, it diminishes its capability to carry out these functions, and a series of negative health effects unfold. It is important to identify the symptoms of silent liver failure at an early stage to facilitate early intervention and treatment. All signs should be understood and help be sought if these occur to help protect the condition of the liver and thereby the whole person. Let us plunge into our study of these important measures of silent liver failure. But before that, remember to like the video. Number 1. Fatigue and weakness. The most common symptom of silent liver failure is fatigue and weakness, which is attributed to the inability of the liver to regulate energy levels. With liver damage, the capacity of the liver to store and release glucose for energy regulation is diminished, causing fatigue and weakness. Besides, liver failure can lead to toxic buildup in the blood, which leads to tiredness and general apathy. These conditions largely restrict the normal life routine. Hence, a normal lifestyle, for instance, working in the field or the office, may become impossible, while maintaining a normal life may even be challenging. People suffering from fatigue and weakness have problems staying awake or focused all day, even in the case of proper rest. Furthermore, as people struggle with the physical restrictions placed on them by their illness, these symptoms may intensify feelings of worry and frustration. Recognizing fatigue and weakness as potential signs of silent liver failure is crucial for early intervention and treatment. If you suspect you may be experiencing symptoms of liver failure, it is essential to consult with a healthcare professional for proper evaluation and management. Number 2. Jaundice. One of the most important symptoms that should be monitored when assessing the chances of silent liver failure is jaundice. It shows up as jaundice from the circulatory buildup of bilirubin, which gives the skin and eyes a yellow pigment. Normal bilirubin is converted to yellow pigment in the body due to the breakdown of red blood cells, and this normal bilirubin is filtered in the liver and excreted in the bile. Conversely, liver failure may cause bilirubin accumulation that induces jaundice. This state usually shows large disorders of the liver, and it may be a crucial sign of liver failure. Jaundice may start mildly, as a subtle yellowing in the whites of the eyes or the skin. With further deterioration of liver function, jaundice may be intensified, diffusing to other sites. Early detection of jaundice and timely treatment would be important for properly assessing and managing liver health. Number 3. Swelling and fluid retention. In silent liver failure, one big symptom is swelling and fluid retention, also referred to as ascites. With a decreasing function of the liver, it fails to synthesize sufficient amounts of albumin, a vital protein that helps preserve the body's fluid balance. As a result, fluid builds up in the abdominal cavity, causing abdominal enlargement and consequent pain. Ascites are characterized by constancy of fullness and heavy pressure in the abdomen, obstructing everyday life activities. Swelling and fluid retention are the other imperative parts that assist in identifying silent liver failure. They are very important from the early intervention and treatment standpoint. Early treatment helps relieve the secondary pathogenic factor that triggers the underlying hepatobiliary dysfunction and eliminates the initial causal factor and the accompanying cofactors. Number 4. Changes in urine color. Changes in urine color can also be used as a massive clue for silent liver failure. Generally, urine is pale yellow to amber because of the urochrome pigment. The urine looks dark or lead-colored if the liver is not functioning well. This indicates that bilirubin, a yellow pigment from the metabolism of red blood cells, is present in the urine. This condition, referred to as bilirubinuria, is characterized by an inability of the liver to break it into ortho and diabilirubin and remove this form through bile. Depending on the underlying liver-associated impairment, bilirubinuria appears from darkening urine color as amber, brown to black. Moreover, other signs of liver partition may be present with a change in urine color, likely associated with abdominal pain and fatigue. Thus, it can be imperative to keep an eye on your urine's color and seek medical assistance if you see any irregularities to discover and treat silent liver failure as soon as possible. Number 5. Easy bruising and bleeding. Another crucial indicator of silent liver failure that must not be ignored includes easy bruising and bleeding. One of the important roles played by the liver is the production of clotting factors necessary for blood coagulation. The liver's capacity for producing these clotting factors is significantly depressed when the liver fails, thus increasing the risk of easy bruising and bleeding. Liver failure patients can see bruising of the skin, frequent nosebleeds and bleeding gums, prolonged cuts, and other injuries. Furthermore, the lowered clotting factors have resulted in intra-body bleeding, which can take the shape of gastrointestinal bleeding or bleeding into the brain, which, if not attended to in time, has a severe effect on life. As such, all occurrences of bruising or bleeding that are not attributed to something should indicate a more serious problem that needs to be examined by a medical professional. Liver failure requires early detection and intervention to prevent development. With easy bruising and occasional internal bleeding as potential indicators of silent liver failure, understanding the importance of such signs is necessary for early diagnosis and proper treatment. Number 6. Itchy skin. Pruritus is chronic itchy skin, whose symptoms can signify different ailments that range from liver dysfunction. If the liver is impaired, it could struggle to properly filter toxins from the blood, causing the substances that cause the itching to build up. Increased bile between the parts that the liver would normally process can cause skin irritation. Furthermore, liver disease can cause generalized inflammation, resulting in skin ailments. Itchy skin is either generalized or localized and may progressively increase at night. Although itching skin alone does not confirm that there are liver issues, it requires a medical visit to answer the cause. Health professionals can make comprehensive evaluations, such as blood tests, to identify and treat the underlying condition that results in the itching. Number 7. Loss of appetite and weight loss. Two major symptoms of silent liver failure are loss of appetite and weight loss, but unfortunately, the symptoms are regarded as insignificant. With the decline in liver function, metabolic processes are impaired, causing alterations in the mechanism of regulation of appetite and digestion. People can feel reduced appetite, thus leading to unintentional malnourishment. This process may, however, be occasioned by some reasons such as nausea, vomiting, and abdomen discomfort, all connected to the deviation of liver functionality. Other than that, liver failure negatively affects the absorption of nutrients, which only worsens malnutrition and weight loss. Identifying these signs is essential as they may point to underlying hepatic disease and the consequence of necessary medical assessment. If not treated immediately, liver failure can advance quickly, causing critical complications and permanent, irreversible damage. Thus, if one loses his appetite and weight, they should promptly seek medical consultation for a proper diagnosis and treatment for probable liver diseases. Timely treatment of such signs will allow the person to take steps toward liver health by preventing conditions affecting this organ's overall well-being. Number 8. Abdominal pain and discomfort. Silent liver failure includes abdominal pain and discomfort as the two critical signs that should be watched. As the liver begins to malfunction and swell up, abdominal discomfort, for instance, inflammation and swelling occurs. This pain shows up as a dull ache, sharp cramps, or a sensation of weight. Moreover, pain, tenderness to the touch, and bloating may accompany the symptoms, underlining the disruption in liver function. In silent liver failure, the pain could feel constant or episodic, and it may have a great impact on daily life and living. Individuals may see increased symptoms after ingesting foods high in fats or grease. At the same time, the condition is that the liver's ability is reduced and becomes impaired at this point, as the liver fails to absorb the fats and oils in greasy foods efficiently. Specifically, abdominal pain and discomfort should never be dismissed, as these emanate from possible liver-related diseases. Emergent medical assessment is vital to determine the source of the symptoms that occurred and initiate proper treatment. Identifying a silent liver failure by recognizing abdominal pain is a matter of controlling liver health, which helps prevent further complications. The undetected silent liver failure leads to grave consequences, and so early detection should be made mandatory for the right healing process. People should have their eyes open to fatigue, jaundice, swelling, alteration in urine color, easy bruising, mental impairment, loss of appetite, weight loss, and abdominal pain if they can act upon liver dysfunction in an attempt to help their bodies recover. In case you are concerned about possible symptoms of liver failure, it is of significant importance to seek medical help to clarify the matter and provide proper evaluation and treatment.